Research has it that 1 out of 13 pregnant women die while giving birth to newborn babies. More worrisome is another report that says 4 women die at childbirth per hour, making it more pathetic that 96 of our pregnant women die daily during delivery in Nigeria. For more perspective on this issue, we have a medical doctor, Dr. Essiet, now joining me in the studio to discuss maternal and child deaths in Nigeria. Thank you for being here this afternoon.
Thank you for having me.
This is very worrisome, as we've just said. What is the root cause of this maternal and child deaths in Nigeria? The root cause?
The root cause is simply that we don't care about the lives of women and children as we ought to. Almost all the reasons for any woman dying as a result of childbirth is preventable. And I can begin to list them. First is, women should not have children when the women themselves are barely growing out, are still children. So you are talking of women that are in early forced marriage situations. 2, such women don't also have education, because research have confirmed that if a woman has secondary education, complete secondary education and beyond, her life chances are greater. 3, access to medical services. This time, access to skilled birth, skilled antenatal and birth is what we are talking about. Many women in Nigeria don't have access, and they don't have access for several reasons.
Are you saying we should begin to promote prevention measures?
Of course, all these things I'm saying aid, because it's about health-seeking behavior that you want to influence.
No, we're quite aware of it. My question is, should we begin to promote them?
Oh, we must, as a nation, if we value the lives of our people. Because I think there is a song, one of the cultures that say, before we had medical doctors, women were giving birth.
Indeed.
So giving birth is not a disease condition. It's a natural expectation that helps population to grow, to sustain itself. So it should not be an issue. However, we know that there are some complications that may arise. That is where medical science per se
Indeed.
will wait to say, okay, how do we deal with these complications? But imagine a situation where a simple decision by a woman to seek help, she depends on another person to give her the right to that decision. That is problematic. 2, if the woman now says, okay, or if they says, I'm ready to go and deliver, there is no facility around her where there is a skilled labor to take the delivery. That is second. When she now gets to that, even if there is a facility around her, there are other extraneous demands that the people make from those facilities on those women, you know.
How do we champion safe motherhood?
Safe motherhood is very easy to champion if each and every one of us makes a commitment that no woman should die giving birth. That campaign has been an African Union campaign called CAMA, Campaign for Accelerated Reduction in Maternal Mortality in Africa. Nigeria has signed on, many African countries have signed on, yet Africa is leading in maternal mortality and child mortality. It is very problematic that Nigeria as a country contributes 10% of maternal mortality of the world. When it comes to child mortality, Nigeria is in the top 3. Not because we have not made progress, but when you look at the aggregate number of women dying, your data was talking of 96 women per day. We have 145 women dying every day as a result of trying to give birth. And that translates in a month and in a year I mean, it's like saying that a plane crashes every day.
That's mind-blowing, really.
Every day in Nigeria.
Now, talking about making commitment, is our healthcare delivery system adequately funded?
I will say that it is not adequately funded, and we know. But that is worrisome. But more worrisome is that the critical things that ought to receive funding to save a woman's life is not, attention is not paid to them as they ought to. For instance, a woman, let's imagine that the woman is me.
Yeah.
So let me use my first name, Uwem.
Yeah.
So Uwem delivers in 2016 a bouncing baby girl.
Yeah.
Uwem should not leave that maternity ward without receiving counseling on family planning, and at the same time having access to family planning services. So if Uwem leaves that maternity ward without counseling and access to contraception or family planning method of her choice, Uwem is going to come back in 2017 pregnant. What happens? Uwem has not sufficiently recovered from that first pregnancy. Uwem is now pregnant again, then anemia in pregnancy, which means she won't have adequate blood. Malaria in pregnancy because she's living in malaria endemic area. Uwem is more likely to be poor.
So who should be responsible for investing in family planning now?
The federal government has made a strong commitment to family planning. We understand that it's been passed in the budget. The Minister of Health has spoken about it at the FP summit in London that just ended. But you know, all of that does not translate until money is released, commodities are purchased, commodities are available at all health facilities, and women can use them when they need them. And
we're told that neonatal mortality rate is 37 per 1,000 live births in Nigeria.
That neonatal death in Nigeria contributes 50% of under 5 mortality in Nigeria.
Well, something needs to be done adequately and real soon.
Yes.
Dr. Essiet, I would like to thank you for joining me on this hour, Midday News, TVC News. Thank you for being here.
Thank you.